If you have been doing Kegels for weeks, months, maybe even years, and you are still leaking when you sneeze, jump, or cough, I need you to hear this. It is not because you are not doing enough Kegels. It is not because your body is too far gone. And it is definitely not because that's just what happens after having kids. The reason Kegels are not working is because Kegels were never the right fix for your body in the first place. In the next 10 minutes, I'm going to explain exactly why that is. I'm going to break down the two main types of pelvic floors, which one is actually causing the most leaking, and what women who finally stop leaking do differently. By the end of this video, you are going to understand your body in a way that most doctors have never explained to you. And you will have something to start that you can actually do tonight to start fixing it. You have been told that Kegels are the answer. Your OB mentioned it, Google confirmed it, maybe a friend swore by them. So you've been squeezing and squeezing and squeezing, and the leaking is still there. Maybe it got a little better, maybe it got worse, maybe nothing changed at all, and now you're stuck wondering if something is just fundamentally broken about your body. You are not broken. You have just been given the wrong tool for the job. I am Dr. Gabi. I'm a doctor of physical therapy and a pelvic floor specialist, and I have spent nearly a decade helping hundreds of women fix this exact problem that you are dealing with right now. I see this pattern over and over in my clinic. Women who have done every Kegel routine on YouTube, every app, every program their doctor handed them, and they are still leaking. And in almost every single case, the problem is not effort, it is information. Here's what we're going to cover today. First, I'm going to explain the two very types of different pelvic floors and why that distinction changes everything. Then I'm going to walk you through the real drivers of leaking that nobody talks about. And I'm going to end with something you can literally try before you go to sleep tonight. Let's get into it. Point number one, there are two main types of pelvic floors, and Kegels only help one of them. Here's the thing that nobody tells you. Your pelvic floor muscles can either be too weak or too tight. And those two problems need completely opposite solutions. A weak pelvic floor needs strengthening. And yes, Kegels can help with that. But a tight, overactive, or too tense pelvic floor, doing Kegels on that is like putting your foot on the gas when the emergency brake is already on. You are not fixing anything. You are making it harder. The majority of women I see in my clinic who are leaking do not have a weak pelvic floor. They have a pelvic floor that is holding on too tightly, and they have been doing Kegels for months. I had a patient come to me after 8 months of religiously doing Kegels every single day. She was doing 3 sets of 10 before her feet hit the floor in the morning, and she was leaking more than when she started. And when I assessed her, her pelvic floor was not weak. It was chronically overactive and could not fully relax at all. Every Kegel she was doing was layering more tension onto a system that was already bracing too hard. What she needed was the exact opposite. She needed to learn how to let go. Think of a muscle that is stuck in a cramp. If your calf is cramping right now, would you flex it harder? Of course not. You would stretch it, breathe through it, and really focus on releasing it. Your pelvic floor is made out of muscles. When it is holding onto too much tension, you cannot squeeze your way to relief. You have to learn to release it first. So the first question is, which type of pelvic floor do you have? If Kegels have not helped you, or if they've made things worse, that is a strong signal that tightness, not weakness, is what your issue is. And that changes everything about how you approach healing. But even if you do have a weak pelvic floor, Kegels alone still may not be the answer for you, because the real driver of leaking is not just about muscle. It is something called pressure. And this is where most people are completely missing the point. Point number two, leaking is a pressure problem, not just a muscle problem. Every time you sneeze, cough, laugh, jump, or lift something heavy, your body generates intra-abdominal pressure, pressure inside your core. That pressure has to go somewhere. Your pelvic floor is what stands between that pressure and a leak. But here's the critical piece. Your pelvic floor has to react before the pressure hits. It has to co-contract reflexively, almost like a reflex. If your pelvic floor is too tight, it cannot move fast enough to do that job. If your breathing mechanics are off, if your core is not coordinating properly, you will leak regardless of how many Kegels you have done. This is why the women who finally stop leaking are not the ones who did more Kegels. They're the ones who learned how to manage pressure correctly. I have worked with runners who were doing everything right in terms of core strength and were leaking still at mile 2. And when I assessed them, the issue was not in their pelvic floor at all. It was in their breathing pattern and how their body was loading force from the ground up. I have actually fixed bladder leakage in runners by treating their trunk, their calves, and their ankle mechanics without giving them a single Kegel. because the pelvic floor does not exist in isolation. It is part of a full pressure management system that runs throughout your entire body. Imagine your body like a water balloon. If you squeeze one part of it up at the top, that pressure has to go somewhere, right? It's going to go towards the bottom. The pelvic floor is the bottom of that balloon. If the top is tight, the bottom's going to bulge. If the bottom is not coordinating with the rest of the system, it will leak. Fixing the leak means looking at the whole balloon, not just squeezing one spot harder and harder. So if you are leaking during exercise, sneezing, coughing, laughing, ask yourself, am I breathing correctly when I do these things? Am I bracing and holding my breath? Because that breath hold creates a pressure spike that your pelvic floor cannot handle in time. That is the whole problem. And this brings me to something that blows almost every single one of my patients' minds every single time I share it with them. Because it turns out there is a direct connection between leaking and a body part you would never expect in a million years to be connected to your bladder. By the way, if you are watching this right now and thinking, why has nobody ever explained this to me in the way that you have, you are not alone. Every single week I break down pelvic health in a way that's easy to understand. Hit subscribe so you don't miss the next one. Point number 3, your jaw and your pelvic floor are connected and chronic tension travels. This is the one that always surprises people. Your jaw and your pelvic floors are linked through a fascial line that runs throughout your entire body. And if you carry tension in your face, clench your jaw, or grind your teeth at night, your pelvic floor is picking up on that tension too. Fascia is a connective tissue that wraps around every single muscle, nerve, and organ in our entire body. There is a direct fascial line that runs from your jaw all the way down through your neck, your spine, your diaphragm, and into your pelvic floor. That means that when you clench your jaw under stress, at work, during a workout, even during sex, your pelvic floor responds by tightening with it. And if your pelvic floor is already overactive, this just keeps layering on more and more tension on top. I see this all the time. I will ask a patient, do you grind your teeth at night? Do you clench your jaw during the day? And they will say yes, but they had no idea it was related to their pelvic floor. That they had been treating the two things as two completely separate problems, but they are not. They are a connected system. Here's a quick check I want you to do right now. Notice your jaw. Are your teeth touching? Drop them slightly. Let your tongue rest on the roof of your mouth, lips gently closed. Now let your shoulders drop. Take one slow, deep breath in and imagine your pelvic floor softening and widening as you inhale. If that felt like a release, that is your body telling you something. And that breath I just had you take, that is actually one of the most powerful tools for pelvic rehabilitation that exists. And almost nobody uses it correctly. That is point number 4. Number 4, how you breathe is either helping your pelvic floor or hurting it. Your diaphragm and your pelvic floor are partners. They move together. When you inhale deeply, your diaphragm drops, your pelvic floor naturally descends and lengthens with it. When you exhale, both recoil upward. This coordinated movement is how your body regulates pressure, supports your organs, and keeps everything working the way that it should. But most of us are chest breathers. We breathe high and shallow, our diaphragm barely moves, our pelvic floor never gets that natural stretch and recoil system. Over time, this disconnects the signal and disconnects the system. The pelvic floor gets stuck holding, it forgets how to let go, and leaking tension and urgency follow. Retraining your breath is not a soft suggestion. It is a foundation that every other pelvic floor intervention is built on. I have seen women make more progress from fixing their breathing in 2 weeks than from months of a Kegel program. One of the first things I do with every patient before any exercise, before any hands-on work, is assess how they breathe. And nearly every woman with chronic leaking or some form of pelvic floor tension has some degree of dysfunctional breathing. And it is that consistent and it is that impactful. Here is how to start retraining this tonight. Lie on your back with your knees bent, feet flat on the floor. Place one hand on your belly and one hand on your chest. Breathe in slowly through your nose. Feel your belly, your ribs, and even your back expand outward. As you inhale, imagine your pelvic floor gently opening, softening downward. Not pushing, just releasing. Exhale naturally and let everything settle. That's it. Do 10 of those before bed tonight. That is called diaphragmatic 360-degree breathing, and it directly retrains the coordination between your breath and your pelvic floor. It takes 3 minutes. It costs nothing, and you can start tonight. But here's the thing. Breathing is the foundation, but it is not the full picture, because everything I've explained today, the tight versus weak distinction, the pressure system, the tension patterns, it all comes back down to one core truth that I feel like every single woman needs to hear that's watching this. Point number 5, your body is not broken. It just needs to be assessed. not guessed. I want to push back on something that gets said a lot in the pelvic health world. The idea that if you just do the right exercises, you can figure this out on your own. For some women, sure, yes, but for most women dealing with chronic leakage, tension, or pain, the problem is not that you have not tried hard enough. The problem is that you have been guessing at a solution without ever identifying the root cause. Your pelvic floor is not a mystery, but it does require assessment. Is your pelvic floor weak? Is it tight? Are you a breath holder? Is the pressure system breaking down somewhere along the chain? Is there scar tissue or nerve tension from a birth injury that nobody ever addressed? These are questions that require eyes on your specific body, not a generic Kegel program, and definitely not a machine that promises to fix stress incontinence in just 6 sessions. The women that I work with who get the best results are the ones who go from wearing a pad every single day to running half marathons without a second thought. And these women are the ones who stopped guessing and got an actual assessment. Not because their problems were too complicated or more complicated, but because they finally stopped treating symptoms and started addressing the root cause. Think of your body like a house with a leak in the ceiling. You can keep putting towels on the floor all day long, and that helps manage the problem. But does it actually help solve the leak in the roof? No, of course not. You could actually go up to the roof and find out where the water is actually getting in. That is what a root cause approach does. It stops managing symptoms and starts fixing what is actually going on and driving them. So tonight, I want you to do 2 things. First, the breathing exercise I just walked you through. 10 slow, deep diaphragmatic breaths before bed. Notice if anything shifts, releases, or feels different. Secondly, I want you to honestly ask yourself, how long have I been dealing with this? How many solutions have I tried? And if the answer is more than a few months with inconsistent results, that is your signal. Not that you're broken, but that you need more than a one-size-fits-all program. You need someone to look at your specific body and build a plan around what is actually going on. Your body is not broken, it is resilient, and it can heal. But it does need the right inputs, and those inputs have to be built for you. Leaking is common. I will say that 1,000 times, but common does not mean normal, and it does not mean inevitable. The women who stop leaking are not just the lucky ones. They're the ones who stopped accepting incomplete answers, stopped doing generic programs, and started understanding what was actually happening in their bodies. You now know more about why Kegels are not working than most healthcare providers ever explained to you. Use that. Your body deserves better than just guesswork.